and welcome to Boomer Health at Home. I'm your host, Maggie Ornazian, Director of Nursing at AmeriStaff Nursing Services. On today's show, Home Care, Is It Right for You? We're going to explore the different aspects of home care and how to keep your loved ones safe at home. I'm joined today by Greg Jamian, founder and CEO of AmeriCare Medical. Thank you, Greg, for joining us today.
Well, thank you, Maggie, for having me on the show today.
So, Greg, why don't you tell me a little bit about what you do?
Yeah, so Maggie, I grew up in the area here. I've lived in Bloomfield Hills for 30 years, and prior to that, Birmingham, and went to Groves High School. So I've been in this community for a number of years, and very happy to be here, raised our family here, our children here. And in Oakland County, I have a business, a company called AmeriCare Medical.
Great. Now, how did you get into this type of field?
Well, I started when I got out of college, and I started in the home care business. I started in the insurance business, and I was in the health insurance business, and I saw where the industry was going. You know, people were getting discharged from hospitals quicker, and so there was a large need for home care because once the patient got discharged, they needed to have the equipment in their homes to rehabilitate. And so that just grew, and later got into nursing, and later into pharmacy services. So it's really been a wild ride.
Wow, that's really great. So you've been in this community for a while, and what other community programs or boards do you sit on?
Well, I'm a board member of the Oakland University School of Nursing, and I really enjoy that board because it helps me format some of the programs and platforms that I use in my own business, which is, you know, the nursing business, AmeriStaff Nursing. And having that, being refreshed with university people and doctorates of nursing around you all the time, it's really an inspiring thing, and it helps me with my business and transforming it to be, you know, best practices and services. So that board seat on the School of Nursing at Oakland University has really been I've also helped them out, you know, giving them some real life practical opinions and knowledge on what it's really like, you know, in the day-to-day work of running a nursing agency. But I also sit on the Manugian Manor Assisted Care Board. I'm the vice chair. I've done that for several years, and it's a assisted care facility that, you know, has about 90 beds, and really it's been an interesting position because I'm able to compare home care to assisted care, you know, on a frequent basis. And knowing both of them, home care is the best bet.
Okay, that kind of flows into my next question. It seems like you're really involved in the community and everything surrounding it. Why did you pick home care?
Well, I think early on I saw home care as being a really viable service to go into, and, you know, it's an industry that just keeps growing, you know, by 15–20% a year, and now with all the baby boomers, 80 million of us possibly needing some of the services from time to time, and you know, it's not just about the nursing services, but it's all the other things that we do. You know, we also have Sun Medical Equipment Company, which supports a lot of people in their active lifestyle. Tennis elbow braces, ankle supports for runners, knee supports, wheelchairs, oxygen, a lot of those things. So, you know, the need for it as the population ages is just becoming more, is greater and greater, you know, all the time.
So you have a little bit more than just a home care service.
Yeah, so what we did many years ago is we integrated all the traditional home care services like home nursing, home medical equipment and supplies and oxygen, and home IV pharmacy. And they're all individual companies, but they're all under the one roof of AmeriCare. And we believe in integrated care, so when we go out to somebody's home, we can handle everything. And we also do hospice, so we can handle everything, and it eliminates the confusion, Maggie, of having 3 separate companies when one company does it all.
Yeah, you're a one-stop shop.
Yep.
Kind of makes it a lot
Yes.
easier for everyone. That's great. That's probably a huge benefit to the patient and their families. So let's talk a little bit about private duty nursing. We see that a lot now. Everyone's wanting care in their home. What does private duty nursing mean?
Well, private duty nursing is a type of nursing that is a private pay. So it's typically not covered by insurance companies. There's the Medicare agency, and then there's a private duty. We are a private duty. Medicare, the nurse comes into your house, spends 1/2 hour with you, and she's gone. Doesn't prepare meals, doesn't help you with hygiene. It's more of an educational teaching visit. Sometimes wound care too. Whereas private duty is more long-term and extended. So if you need somebody to stay in your home for 4 hours, 6 hours, 8 hours, or even 24 hours, 7 days a week, private duty, which is a service that we offer, we've been in it for 35, 40 years, is the best bet. And people want their independence now. And as you grow older, you lose your independence. But our private duty service, AmeriStaff Nursing Services, helps you retain your independence. And it's a great thing. And we're able to keep people at home so they don't have to leave and go to nursing homes or assisted care. The satisfaction factor is significant.
Mm-hmm. And from a nursing aspect, it seems like you keep them safe and gives the family peace of mind as well.
Yeah, we see infection rates dropping. Our infection rates are not even significant compared to being in a nursing home or assisted care. Plus, there's no lockouts. Some of these, during COVID, a lot of people were in assisted care, and they couldn't even be visited by their family members. Whereas home care, you're the boss, and private duty, you get to choose the nurses that come to see you, the physical therapy, when, the schedules, and your loved ones can still visit you at home in your comfortable surroundings that you're used to, with little Fifi, your dog, right to your side,
right.
and has tremendous healing power.
So there's a lot of autonomy in home care as well.
There is.
That's great. That's a very good aspect. So we've talked about private duty nursing. So you employ nurses. How many nurses would you say?
We have about 300 nurses and caregivers, which in recent times now, trying to find caregivers and nurses is really difficult. But we have a lot of experience. We've been doing it for many, many years, and we always have nurses. We always have caregivers.
That's great. So you did mention earlier Sun Medical, and it's a home equipment company. I know you do have, I was reading in the paper, a new venture for AmeriCare Medical. Can you touch on that a little bit for us?
Well, I'm super excited about that. People say, why would you want to open a retail store when everybody's buying items online? Well, we found a great location in Birmingham, right on Woodward Avenue, and it's our brand new location, and it's just south of Papa Joe's. Everybody knows where Papa Joe's Market is, and we can't miss it. Big sign, Sun Medical out in front, and it's a state-of-the-art store with concierge services. We have nurses on site, and it's really a kind of a pleasant type of atmosphere inside when you walk in and see how everything is laid out conveniently. And people want that professional interaction. When they're looking for something, they don't want to just take a chance online and deal with China and wait a month before it comes in and then it's wrong and you can't even read the instructions. People, we have found in our research, they still want to come in and shop for it. It's an outing. They get out, they come, easy in, easy out, free parking, and they have the expertise of our staff, trained staff, educated staff, as a plus when searching for the items they need.
Mm-hmm. And with most DME, durable medical equipment, I would find, especially as a nurse, that we need that walker right now. I need those units right now. Would you say that we can go to the store in Birmingham and pick everything up right then and there?
Well, yeah, you can walk in and walk out with something that fits you, because that equipment sometimes has to be customized to your needs, and we can do that right there on site. And if you can't make it to the store, or you send your daughter in and she picks it out for you, or your son, we can have it delivered to your home as well.
Okay. So you had mentioned concierge services. What kind of concierge services do you offer to your customers?
Well, for us, it's not just about selling the product. It's about getting to know the patients, the customers, the clients. And it's about going outside of the box. It's, we don't, no two customers are the same. And so people have different needs. We extend ourselves to offer a lot of different things. For example, somebody can come into our store in Birmingham on Woodward, and we have conference rooms in there where they can sit down with a nurse, go over some of their special needs. They may be coming in for a blood pressure kit, but want to talk about a nurse about setting up a home care private duty nursing in their home situation, and that's available too. So, we really cater to the patients, and the concierge service is more about like, hey, tell me about yourself, rather than, hey, let me sell you a wheelchair, or let me sell you a blood pressure kit. It's all-encompassing type of service and a relationship that we like to build with our clients.
Yeah, it sounds like AmeriCare really does care about their patients that come in.
We do.
That's great. And you had mentioned earlier that you do home IVs?
Yeah, so we have a company called RxIV. It's about 25 years old. And, people that have infections or need to be fed intravenously would utilize our service. It's a physician-prescribed service, but it's very helpful and useful. And during COVID, it's been great. It's a great service to administer some of the medications that some of the physicians prescribe. But we also do other things, like there's this thing, therapy we call a Meyer cocktail. And we've had all kinds of interest in this, and basically it kind of boosts your immune, a lot of vitamin B supplements in there, and it's a lot of people that are seeking that extra boost from a standpoint of nutrients will ask for a Meyer cocktail. So that's one of the things, and we do other similar things too, but we always recommend that you talk to your physician first and come on in and see us.
Wow, that's so great.
We did have a rapper come into town, and it was staying downtown, and before his performance he has to have these nutrient injections, and so we had many nurses that wanted to volunteer for that because they got to go to the hotel, go to the room, and provide the therapy in the room. But that was an interesting case.
Wow, that's really cool. Yeah. You guys are famous. So now going back to home nursing agencies, do you guys have any new ventures with that?
We do. We are, thank you for asking, we're rolling out a company called Private Reserve. And what we have found is nursing has has different levels. And being in the Birmingham, Bloomfield area, a lot of the customers around this area, Grosse Pointe as well, have a higher requirement of service that they want, and they're willing to pay for it. So we came out with this private reserve nursing, and it's brand new, and you know, our nurses are trained in protocol. They're all confidential, and our clients are a lot of international companies that come into Detroit that do business here, that need a nurse or a caregiver for whatever reason, for 4 hours, 8 hours, 12 hours, or many people that live in the area here. It's a demographic specific business. So people that might have confidentiality needs in their home, and they want a caregiver that, you know, has been vaccinated. All of our caregivers primarily are vaccinated, but the assurance of vaccinations, confidentiality, and trained in protocol is really important to them. So it's a higher level service, a higher price service, but it's a guaranteed product service line that is really popular, especially in this Birmingham, Bloomfield, and Grosse Pointe area.
Yeah, sounds like a quality, skilled service that you offer. Going into now non-skilled services that may be offered, you hear a lot about things like care.com or helping hands. Is this kind of like a non-medical service? Is that something you guys provide?
So you have to be careful with that because what I like to say is anybody that signs up with our services, private duty services, they get a nurse that comes along with that, overseeing the case and the patient, and there isn't a charge for that. Because we know that patients' health status changes from time to time, and only a nurse can really determine that. So when we don't prescribe to non-medical home care, because we think that all home care should have some kind of nursing component to it. But you have to be careful with all these national companies, homecare.com or care.com, or you know, dealing with a local company makes a lot more sense, because the local market, like for example our company, we know the market. We know the people in this market. We know the caregivers. We know the good nurses. We know the job market. And so we're a lot more, and we know the area. So we're a lot more responsive than some of these national companies can be. And they're not as personal as we can be with the patient.
I've also noticed too, a lot of your nurses have really good working relationships with the physicians that are within the community as well.
Yeah, and that's very important. The physicians are really the first line of care. People seek out the physician when looking for home care, and you know, physicians all respect nurses, and nurses all respect the physicians, and so it's really we like seeing that team in place when we're taking care of a customer.
Okay, that's awesome. What about training? You've mentioned that before. What kind of training does your staff go through?
So our staff goes through a rigorous training. We have quarterly requirements for our nurses, for our caregivers, and I don't know if I mentioned it, but we're accredited by the Community Health Accreditation Program, which requires us to validate that we're providing this training to our staff, and we want to make sure that the people that go into people's homes are adequately trained and knowledgeable. And we think we have some of the best trained and educated staff going to people's homes, probably in the state of Michigan.
So for someone seeking some home care, what would be some questions that they should ask?
Well, you should always ask. I mean, I would ask, are you a national company or local company? I mean, I would prefer, I think people would prefer a local company, but you should ask how many employees you have, how many nurses you have, do you have nurse oversight, are you accredited, how long have you been in business, what do you do to vet your employees? Because these are, our employees are going to people's homes, and our customers have a right to know that we're doing our work behind the scenes in, vetting the employees, background checks, and so on and so forth, and going through the bonding and insuring process. We find that that's really important, and it's a necessary component to our business.
It sounds like you guys go the extra mile to establish trust in the home.
We do. Well, we always say, we would never want to send somebody into your home, into our client's home, that you wouldn't want coming into your home and our home. So that's kind of the guiding light when we do our hiring, and we reject a lot of people. It's not, a lot of companies, anybody that comes through the door, they're hired. We probably reject 20–30% of the applicants that come to our company because they're just not qualified or up to our standard. We do say, come back when you've learned how to do this, or you've learned how to do that, or you have more experience, but we're very strict on the people that we hire.
Wow, that should give people a lot of peace of mind. That's great.
Yeah.
So we've talked about service areas. I know that you've grown up in this area. So does AmeriStaff Nursing Services just service like Birmingham, Bloomfield, Beverly Hills?
That's our primary focus, Maggie, but we also are in Farmington, Rochester, Dearborn. We really service the 5-county area. We've been around a long time. We have referring hospitals all over. Beaumont's a big client of ours, St. Joe's, McLaren, St. John's. We get a lot of referrals from those hospitals.
Okay. So we kind of talked about your screening process with employees and the vetting process and things like that. What are some of the risks people take by finding a caregiver through the newspaper?
I can't tell you how often people say, well, Greg, going through an agency is a little more expensive. And it might be, but we have insurance, we have vetting, we have the management that goes behind it. Some people are really taking a risk when they hire. We used to say out of the newspaper, but now it's online, which is just as bad, right. Or using Craigslist to find caregivers. There are a lot of predators out there, and I just caution people all the time, you're better off going through me, an agency, where we make sure that you're being taken care of in the appropriate way. So I just I'll put that out there, that people need to be very cautious when they hire on their own, and they don't go through an agency, because we have all the things in place to make sure that the people we send out aren't going to steal from you. They're not going to be verbally abusive or physically abusive, or many other things, financially steal from you. So those are all things that people should consider before going and trying to hire on their own caregivers.
In your experience over the years, we've kind of touched on what you should ask. What are some things you should avoid when seeking out a company?
Well, I think if you don't get callbacks, I think if you get an answering machine, those are all telltale signs of maybe you want to cut and run. If a nurse doesn't come out to your home, an RN to open the case, they just maybe send a salesperson. We do have salespeople that do go out from time to time, but it's always followed by an RN. And so that's one of the things that's really important. Where they're located is important. Or if they're out of state and it's just a franchise, how long they've been in business. So those are all things that you should be careful of.
Yeah. So since you do have nurses available, are they available 24/7?
They are,
Okay.
24/7, and we ask that we get a day's notice. but we can pretty much take care of any situation that arises, and you can call us at our main number, and I think there's a slide at the end of the show that shows that, and we'd be glad to have a consult with you, which is of course free of charge.
And going back to being quote unquote on call, my nursing audience knows what that means. You have multiple people on call 24/7?
So when you call our company at 10 o'clock at night, you're going to actually talk to somebody. And if you ask to talk to a nurse, there's a nurse that is available within 2-3 minutes. And so, yeah, we're pretty proud of that. Healthcare is a 24/7 business. Somebody asked me the other day, Greg, I might need to get a hold of you. Can you give me your cell phone number? And I said to him, call me anytime, because I'm in the healthcare business, and it's a 24/7 type of career.
It definitely is. Healthcare is a 24/7 career. That's just the way it is. So can you describe to me some of the specialty programs that you guys offer?
Yeah, dementia care. We do a lot of post-surgical rehab when people come back to the home. We also injury. We have a specialty in injury, spinal cord injuries, closed head, traumatic brain injuries, so stroke patients. So it's all really across the board.
Yeah.
We deal with a lot of variety in home care, and that's what I love about the business. I don't love the fact that people are sick or getting injured, but
right.
I love the fact that we are a solution to help these people out.
You guys really do it all.
But we love what we do, Maggie, and we do it all. And we are a one-stop shop, all under one umbrella, and it's really worked out well for us over the years.
Great. Years in business. You've mentioned some of your companies are 20 plus years old. Do you think that shows a sign of good quality?
I do. It just shows resiliency. It just shows stability. There's so many people that are trying to do this home care online now, and it requires the personal touch. And we like to say that we're not high tech, we're high touch. However, we do have a high tech component in our business, and we've had to, because it's become so complex. Yeah, high touch, not high tech.
That's wonderful. So lastly, Greg, I'm just going to ask you one more question, and I want to thank you for all your time today. What should your viewers know about home care?
Well, they should know, Maggie, that they are not alone, okay? There's a lot of services out there to help them if somebody's at home and they're not feeling well and sick and they need the supportive services that we provide. They are not alone. All they have to do is pick up the phone and call us, and we can come out and make their life better.
Wonderful. And they'll always have someone to talk to.
And they'll always have someone to talk to, yes.
Wonderful. Well, thank you, Greg, for your time today. This has been great news about home care.
Yeah, well, thank you for having me.
Thank you for joining us today at Boomer Health at Home. I'm your host, Maggie Ornazian. Please feel free to give us a call at 248-288-2270 for any questions about what we talked about today. Thank you, and stay healthy.
Hello, my name is Greg Jamian, and you have been watching Boomer Health at Home, powered by over 40 years of home health care experience and knowledge, and our sponsor, AmeriCare Medical. Our show is focused on your health, offering cutting-edge answers and solutions to questions impacting your daily life and/or loved ones. Don't forget to join us for all our other shows in our Boomer Health at Home series. And please, like us if you enjoy our shows.